My name is Kylie Altman, and I'm a nurse practitioner with SIMEDHealth in Lake City. Absolutely. Hot weather can affect diabetes because it alters the way that your body is able to work with insulin. This can cause fluctuations with your blood sugar, both up and down. Diabetic nerve damage can also cause issues with your body cooling itself by sweating, and so that can also create issues. Cardiovascular wise, the heart has to work harder in order to cool the body, so that increased workload on the heart can then increase your risk of cardiovascular events such as heart attack, palpitations, heart failure, things like that. There's a bunch that can do that. So first you have diuretics that, increase the rate that fluid is leaving the body that can lead to dehydration. You have amphetamines that increase the resting metabolic rate and therefore increase the heat production that the body makes. That can exacerbate things like heat stroke or heat exhaustion. Over-the-counter medications like cold and flu medications, allergy medications, those can inhibit your body's natural sweat response. GLP medications lower your thirst response. Blood pressure medications can make you susceptible to sunburn or also inhibit your body's natural sweat response. So there are many across the board that can have an effect. If you're having signs of heat exhaustion, you should see your provider. Those are going to be after an hour of sitting in a cool area, trying to hydrate yourself. You're still having vomiting, trouble keeping fluids down, weakness, fainting, or signs of rhabdomyolysis, which would be like Coca-Cola colored urine. If you're having signs of heat stroke, then that's an emergency and you need to call 911. Those would be signs like altered mental status, slurred speech, lack of sweating, dry, hot, red skin, body temperature of 104, rapid breathing, rapid pulse, or loss of consciousness. Okay, there's lots of things that you can do with a chronic condition to stay safe. First is going to be knowing if you're on a medication that increases your risk of sunburn, dressing appropriately if you are. If you are somebody with a cardiovascular or respiratory issue, limiting the time that you are out in the heat because that increases the stress on the heart and lungs. If you're diabetic, then you want to make sure that you're checking your sugar more frequently because of those fluctuations that can occur. Being aware that your insulin and your glucose monitor are not going to do well in the heat, so you want to make sure that you're storing those properly. Most important, I would say, is try to pick your time of day to work out to be the less hot part of the day, so either before 10 or after 6. If you do have to work out during those peak heat hours, then try to find a shaded, breezy area to work out in. Wear loose-fitting, light-colored clothing that's moisture-wicking to try to help your body stay cool. You're going to need to hydrate. Make sure you're doing that. If you're going to exercise for more than an hour, include electrolytes in your hydration. And then, of course, you want to cool down really well after you're done working out.